I think one of the most important things that I've found that works well for me is just honesty
Mm.
and telling families when you don't know,
Mhm.
Mhm.
telling them your level of confidence that your choices will work or that they won't work and why you are making them. The other thing I think that we have a tendency in medicine in general to want to give good news.
Mm.
And I think that in the care of children with BPD, we often have to give not a lot. It's not bad news, but it's like less exciting news, right? So, how long is a child going to be in the hospital? Well, if they come to our center at 40 weeks postmenstrual age, they'll probably be there for another 5 or 6 months,
Right.
and they're often shocked to hear that number. And so I'll say, all right, well, this is how I came up with that, right? Your baby's here. It's going to take me a month to get them to here, and then it's going to take me a month to get them to there, and
Mhm.
then it's a week after that. Each week I'm going to do X, Y, and Z, and that's a best case scenario. And already you can see
Mhm.
how I've come up with 4 to 5 months out of this. And then they say, oh, I sort of, I kind of get that. I think it's okay to acknowledge that we don't know what we're doing. We have experience in these kids, but we're trying the best that we can. And
Right.
many children follow the rule book, right? And we've talked about a couple of times that, we the first week we do this and then we do the weaning, and that's what happens with most kids. That's why we do it and it works. But there are kids who don't follow that rule book, and your baby happens to be one of them. And
Mhm.
I can't change that, but what I can do is work with you and your child to help have the best outcome for that baby as I can. I think that level of honesty and sort of working through why we're doing what we're doing and how it might be different from what they've encountered at another hospital, it generally works.
Mhm.
Families are still going to be frustrated, and that's okay. I'm happy to be their sort of verbal punching bag when they're
Mm.
having a bad day. I've got thick skin, and it doesn't really bother me. So if they want to say, you guys are dumb and you don't know what you're doing, and so on and so forth, just like lay into me for like 10 minutes.
Mhm.
That's okay. And then after that passes, we can talk about what we're going to try to do. I can tell them that the vast majority of babies survive to discharge from our hospital, and that's my expectation for your baby.
Mhm.
Everything after that is far more uncertain.